is Doc. Thanks for coming along with this drive with me on this beautiful Friday afternoon here in wonderful Lancaster County, Pennsylvania. It is beautiful out, the sun is shining, the temperatures are up in the mid-60s to 70s. I tell you, we finally made it through the winter, it looks like, and real happy about that. Looking forward to just a wonderful spring ahead of us and hopefully moving into summer. So as we kind of mentioned at the start, this one's going to be an all equine driving with Doc, and we're going to talk about equine herpes virus because it's been in the news of late, especially if you're a horse racing fan like myself. You've been following it. It's been affecting some of the tracks. Some of the barns at the tracks have been put on quarantine. It's affected horses being able to ship to various racetracks to be able to race. A lot of, kind of quarantine provisions put on some of these barns, which of course is a big concern for everybody in the racing industry, but obviously if you're in the horse transport industry, if you're involved in any way, shape, or form with horses, you want to be aware of this because it is something that is kind of ubiquitous out there, and almost every horse has been exposed to herpes at some point in their life, and we'll talk about that in a little bit. The one kind of caveat I'm going to put on this talk is that, as many of you know, I am not an equine vet. My specialty really ranges in small animals, dogs, cats, shelter medicine, nonprofit work, that sort of area. So this is going to be kind of a very general overview of equine herpes for everybody. I'm sure there's much more detailed things that equine veterinarians can get into. They are the ones that you want to definitely talk to if you have any concerns about equine herpes virus in your horses. Again, this is going to be an overview. I'm not an expert on this. Hopefully I've got most of this stuff right, from the research I've done. If there are any equine vets out there that are watching this, if I have messed something up or I haven't explained something exactly perfectly, please let me know by emailing me or just putting a note in the comments, as obviously we want to make sure that we provide the most accurate and up-to-date information at all times here on Driving with Doc. So with that said, let's kind of dive right into a little bit about equine herpes virus. And of course, by the name, as you can probably figure out, it is a herpes virus, and there are various types of them. They're typed by number based on their genetic makeup, and they're usually, I think there's about 5 or 6 that can kind of float around the equine specimen, if you will. But the one we're really going to focus on, and the one that everybody talks about a lot of times, is equine herpes virus type 1, or EHV type 1. And that is because that is the strain that sometimes can lead to the severe neurologic issues that we'll talk about in a minute in horses. But backing up for a second, so it is a herpes virus, which means that like herpes viruses in people, but I will stress it's not we can't get the type of equine herpes virus issues that horses get. Horses can't get our herpes virus, so just be aware of those types of things. But sometimes you may have heard equine herpes virus talked a little bit more as equine rhino or equine rhinopneumonitis. Those are kind of synonyms for it, and sometimes more in the layman's terms, you'll hear people call it equine rhino. So just be aware of that. So with type 1 equine herpes virus, or EHV type 1, we usually see 3 main sets of symptoms, depending on how the horse is affected. Most commonly, if they are going to be affected and show signs, they're going to show the respiratory signs of the disease. And that usually means that they're probably going to be running a fever. Sometimes it's what we call a biphasic fever. So they may spike a fever, for a day or two, and then they're fine for 5 or 6 days, and then all of a sudden, around day 7 or a little bit later, they start spiking a fever again. That sometimes can be a sign that a herpes virus infection is active and going on. You may also notice them horses being a little off their feed, a little listless, not really as gung-ho as they used to be. Sometimes you'll notice some nasal discharge coming from them. You may notice a little bit of a cough here or there. So those are kind of the main upper respiratory signs that you would see with the respiratory form. With pregnant mares, especially those that are usually past about 5-6 months of gestation, you may all of a sudden notice abortion. And this is more of a concern, obviously, if you're on a breeding farm or something along those lines. Just the regular person with a horse in their backyard or stuff, unless you're breeding them, you don't obviously have to worry about the abortion so much, but sometimes it can lead to what we call abortion storms on a farm, which is just a term meaning that a bunch of mares aborting in a close period of time, all due to this equine herpes virus. And then the final clinical sign that you sometimes can see, and this is the one we don't want to see, and we obviously are most concerned about as veterinarians, is the neurological form. And the neurological form doesn't affect that many horses. There's still a little bit of uncertainty as to why some horses develop the neurologic symptoms with each equine the EHV1 and others don't. There's some mystery there as to why that seems to happen. They have seemed to actually dissected the Equine Herpes Virus 1 genome to kind of like a substrain, and that substrain does seem to be more linked with the neurologic form. So that's something we'll talk about in testing when we talk about how we test for it. But obviously, you know, signs of the neurologic form in horses would be something we call ataxia, or kind of a stumbling gait. They appear incoordinated. Some equate it to the horse looking a little drunk when they're walking. Sometimes it's focused more towards the hind end. So sometimes we see more issues just with the hind limbs, loss of kind of tail tone, so they don't really move their tail that much. They may have some problems urinating and defecating, but it can also affect all the limbs. It sometimes can even go up and cause kind of what we call a palsy in the face, so a drooping of the face. So again, there's really no set rule on this as far as these symptoms mean Equine Herpes Virus 1. And obviously any neurologic signs you want to worry about in your horse, and definitely have your vet check as far as all of that goes. Now, the severity of the neurologic signs in horses really can vary. You know, to where maybe they're just a little wobbly, to the point where they're down and they can't rise, they can't get up. And sometimes in those cases, the only thing that we can do is humanely euthanize those horses, as there's just nothing we can really do to, you know, reverse some of those symptoms or keep them comfortable without other secondary complications coming in and things like that. So those are kind of like the three main syndromes we see with Equine Herpes Virus 1 and the things we worry about. Herpes virus is very interesting in the fact that almost every horse is probably exposed to it, either as young foals and then again through their lives. And once a horse gets herpes virus, and again, it's sort of like us, once we get a herpes virus, it never truly goes away. It just becomes what we call dormant or latent, which means that it's just kind of hanging out. It's not strong enough or replicating enough to cause active infection or to produce shedding of, you know, the virus. It's just kind of hanging out in the body, and what usually brings it on to become more active again and potentially cause symptoms, signs of infection, and also be an infectious particle at that point is usually a stressful event. So this is why we do see it in the racing industry a lot, in show populations, and horses that travel to shows. You know, all of those are stressful situations, and that can affect the immunity of the horse and potentially allow the herpes to kind of reactivate and then cause some symptoms. It's also important to remember that with herpes virus, again, both in people and, you know, other species and all that, a lot of times the virus will activate, but the horse will not show any symptoms. So these are what we kind of call subclinical carriers that can potentially then cause some of, you know, the horses to start shedding virus, but they look perfectly healthy. And so that's one of the biggest problems we have when it comes to dealing with, you know, quarantine and containment and all of that. And that's why the quarantine measures are so strict, and we'll talk about quarantine in a little bit. But just remember that. So once they kind of have herpes, they pretty much have it for life. You can't fully eradicate it from the horse, and it's just something you may have to deal with from time to time. And I'll be honest, almost every year, at least in the racing industry, we usually do see a barn or two somewhere on a racetrack that has horses that have been confirmed to come back positive with herpes virus, and those barns are quarantined. It's you know, it's just kind of the nature of the beast with those types of housing environments and everything else that's going on. So, you know, that's an important thing to remember, is we're always going to see cases of this, and it's just important to always have on your radar in, you know, the back of your mind with all of those things. So again, we talked a little bit about the neurologic form again, and that's the one that we are concerned about the most. And sometimes these horses will just all of a sudden appear down. They may show some ataxia beforehand, but you may just come in one day and your horse is down and can't get up, or they're showing other severe neurologic signs. So, you know, it's something to be aware of and always have in the back of your mind, and always be willing to talk to your veterinarian about as far as testing. So talking about testing, so then the question is, if you suspect your horse might have herpes or be actively infected and potentially shedding, what is done about, you know, what is done when you call your vet? How do they test for it? What kind of testing do they do? Well, normally what they're going to do is your vet's going to do two types of tests. They're going to do a blood test, and they're going to do what's called a nasal swab test. Everybody out there is probably very familiar with nasal swab tests now with COVID that has been going around, and it's pretty much the same type of swab that we're doing there. there. Obviously a slightly longer swab, maybe a little bit of a bigger swab because we are dealing with horses here. But so what we're looking for when we do both the blood test and the nasal swab is we're looking for active signs of infection. And the way we do that is by running what we call a polymerase chain reaction, or a PCR test, on both of those samples. And what the PCR test is assigned to do is to look for the genetic makeup of the virus itself. So if we find that in blood, we know that that horse is actively infected, because it's normally not going to be shedding in the blood if it's a latent infection. And so we know that horse is actively infected at that point. And if we find evidence of the virus in the nasal secretions, then we know that horse is also actively shedding virus. And those are two very important things when it comes to dealing with equine herpes virus in a multi-horse stable or a racetrack situation, show horse situation, anything like that. We need to have that type of information. And so those are the two types of tests basically that your vet is going to do to see if your horse is positive. Now, if they come back positive and they are showing symptoms, usually what's going to be done is we're just going to try to treat them symptomatically. So if we're seeing, potential neurologic signs, but they're not too severe, the horse is probably going to be treated with some anti-inflammatories to try to knock down the inflammatory reaction. Definitely some fluids, maybe some painkillers as well. Anything to try to keep the horse comfortable. Sometimes they are referred to university hospitals or referral hospitals where they can get some more in-depth treatment and things along that line. If your horse is showing the respiratory form, usually it's just going to be kind of supportive care. So if they still are eating and drinking okay, it's probably going to run its course in a couple of days and the horse will be all right. If they are really off their feet or they appear a little bit more ill, again, they might be doing some fluid therapy to keep your horse hydrated. If there's evidence of maybe secondary bacterial infections going on, which we sometimes see with these upper respiratory viruses, your horse may be put on some antibiotics for a while as well, just to clear any secondary infection and to make sure that your horse stays as healthy as possible. With the neurologic form, if it does get really severe, as I said, sometimes unfortunately, euthanasia is the only option we really have for these horses, which is very sad, but it definitely prevents further suffering and any kind of pain and anguish that the horse might be going through. So that's kind of, the brief overview as far as treatment goes. Big thing also to remember when it comes to equine herpes virus is that it is in most states a reportable disease. And what that means is that if, your horse is even being tested or suspected for it and a test is being done, your veterinarian who does the test has to report the fact that this is going on to what is known as the state veterinarian. And the state veterinarian is employed by usually the state's Department of Agriculture, and they are responsible then for setting up what steps follow in the event of a positive or a negative. Now, if a test is pending on your horse and you are in a barn with other horses, that state vet is probably going to come in and they're going to put what they call a quarantine on your barn. And that means basically that no horses in, no horses out. That barn is basically shut down until the test results come back on that particular horse. If that horse tests negative for equine herpes virus, then the quarantine is going to be lifted. And usually that's only 1 or 2 days. These tests come back fairly quickly from the state labs now. So you have nothing to worry about. If your horse or a horse in the barn tests positive, then usually a quarantine for a period of 21 to 28 days is going to be put on that barn, and that means different things depending on what the barn is. If it's a racetrack barn, obviously they do a lot of different things as far as different training hours for the horses, all of that, and I'm not going to get into all of that stuff, but there will be rules put in place as far as what you can and cannot do. And obviously the big one is no horses can leave that barn and travel anywhere unless they're going to a veterinary facility for treatment, and no horses can come into that barn until the quarantine is lifted. And the reason for that is because herpes is very contagious. It's usually spread from horse to horse through nasal secretions. As I said, that's why we do the testing on the nasal swabs. But, it also can be spread very easily by what we call fomites. And a fomite is basically any inanimate object and also animate object, namely you and I. So this is why the other part of the quarantine and what is going to be discussed in detail by the state vet with your vet and what your vet is going to pass on to you is the importance of really strict disinfection protocols in your barn and regarding your horse's equipment and, water buckets, feed buckets, all of that stuff is going to be very strictly monitored for proper disinfection. And there's some good things and bad things about that. The bad things obviously is it's a lot more time consuming, but it is a good habit to get into, even though it is time consuming to keep things really well disinfected. The good news is, though, that herpes virus does not usually last very long in the environment. Maybe 5 to 7 days under, really good conditions. And it's also pretty easily killed with a lot of the modern disinfectants that are out there. So what you're going to be asked to do is really focus on doing proper disinfection for all of anything that is involved in caring for your horse. So as I said, water buckets, feed buckets, any grooming equipment, bridles, halters, lead ropes. It's a good idea if you're going to be working around your horse just wearing regular vinyl or latex gloves that you can dispose of, because any kind of contact that horse has with you, you can then transmit the virus to another horse, if you come into close contact with them without properly disinfecting things. One little tidbit on disinfection. Disinfection is different from cleaning. And a lot of disinfectants that are out there for these types of things don't work as well when there's a lot of what we call organic matter on whatever piece of equipment or bowl or whatever that you're trying to disinfect. So it's really important to make sure you clean all of these pieces of equipment really well first. Get the dirt, mud, muck, snot, whatever off of them, and then go ahead and use your disinfectant as described and as prescribed on the label to make sure that you definitely kill everything off. And this is something you're going to have to do daily, every time you go into the barn to take care of your horse, every time you leave the barn, anytime you use any piece of equipment on your horse, as we've said before. So keep all of that stuff in mind. You are going to be asked to do all of that, and it's going to be really, really important to follow all those protocols. Now, while the barn is under quarantine, normally what happens is every horse in the barn is going to be monitored very closely for any signs of infection. So that usually involves, at minimum, doing daily temperature checks, usually twice a day, to make sure the horse does not spike a fever at any point. And if any horse starts showing symptoms or starts showing a fever, that horse is probably going to be tested. And if that test comes back positive, well, then your quarantine starts all over again. So your quarantine basically starts, the time frame for your quarantine is based on when the last positive result was. So if you have horses in your barn and unfortunately, let's say different horse tests positive every 7 days or so, well, that can be a long quarantine, unfortunately. Nobody hopes for that type of situation, but just be prepared that if other horses test positive in your barn later than your horse or the initial horse did, that quarantine is going to be extended. So keep all of that stuff in mind. Some places will go to testing every week, every horse in the barn every week, looking for signs of active infection. And usually, depending on the rules of the state or what the state vet wants to do, you may see that all of the horses in the barn, as they're exiting quarantine or coming to the end of that quarantine, right around that last day, they are all going to be tested. And if they all come back negative, that's great. If they, for some reason, unfortunately, one of them does come back positive and it was just not showing any clinical signs, and your quarantine starts all over again, my friend. There's exceptions, very rarely, but some exceptions to these rules. And again, this is where talking with your equine vet is much more important than listening to me on this, because they are going to be able to deal with things on a case-by-case basis. So keep all of that stuff in mind. So with all of this, this being so infectious and, being a concern for horses and all of those things, the question then comes, well, can we prevent it? Can we do things to prevent equine herpes virus? And the answer is sort of. Obviously practicing good biosecurity, disinfection, cleaning with all of your horse's equipment on a daily basis will certainly help reduce any chance of your horse coming down with it. Making sure that you're monitoring your horse very closely for any signs of illness and alerting your vet right away to make sure that if it is herpes, you can get on it pretty quickly. But there is a vaccine out there for equine herpes. Sometimes it's called the equine rhino vaccine. And, it certainly is given. It does help in prevention of disease, though the one thing that unfortunately is a little bit of a downside with the vaccine is that it does not seem to provide great protection against the neurologic strain. And so that's one of the downfalls of the vaccine, unfortunately. But that's a minor downfall, really, in a lot of veterinarians' opinions. It really probably is still a good idea to get your horse vaccinated for equine herpes virus, especially if they are going to be traveling to shows. Some shows and a lot of show circuits are actually requiring it now that they have an proof of a herpes virus vaccine within within 6 months before the show. And so you, again, want to talk to your vet about it to make sure, your horse is the right one for the vaccine. But we are seeing a lot more horses getting vaccinated in combination with, the equine influenza vaccine, also getting a herpes virus vaccine as well. So that's really, the vaccine does provide some protection, probably not as much as we would like, but no vaccine is perfect, unfortunately. And thankfully, even though we still don't quite understand why this is, at least to my knowledge, and again, if there's equine vets out there, please let me know if they have figured this out yet, aside from the gene subtyping. A lot, majority of the horses are not going to develop the neurologic signs, and that's a very good thing because we obviously don't want to have to deal with that any more than we already do. So that's kind of a brief overview of everything involving equine herpes virus, and there's a lot more in there. Like I said, there's other types out there that can cause some other issues with respiratory disease and things like that, but really no point in diving really deep here because this is something you obviously want to talk to your vet about if you do have further questions in regards to equine herpes virus and your particular horses. So that, of course, brings us to everybody's favorite time of the drive, partly because that means we're coming to the end and you don't have to listen to me too much more, but also because it recaps everything. That's right, it is time for Doc's Top 5 takeaways on this drive through the countryside when it comes to equine herpes virus. So let's get started. Number 1, remember that equine herpes virus 1 is type 1 is the one that we worry about usually the most, and it usually causes 3 potential different clinical syndromes. The first of which being the upper respiratory signs and things that we talked about there. The second, if you have pregnant mares or working on a breeding farm, abortion is certainly a big concern. And third, which hopefully we do not see too often, is the neurologic form that can take evidence of various clinical syndromes involving neurologic dysfunction in your horse. So those are the 3 syndromes to remember. Number 2, remember that almost all horses are exposed to equine herpes virus, usually when they're young foals or, at some point in their lives, and they usually may get a mild infection or not show signs at all, but the virus does not go away. It does remain latent in their system, and sometimes stressful events can bring the virus back out. So, and horses, as we know, can stress at very minor things. So just be aware of that even though if you think your horse has never ever been exposed to herpes, but you have not had it from the time it was a foal and it was not exposed to any other horse, possible, more than likely that horse has been exposed to herpes at some point and it was latently infected. Number 3, the neurologic form is the one that we worry about the most and is the most severe form. And so if you notice any neurologic signs in your horse, you definitely want to contact your veterinarian immediately. Obviously, there are other disease conditions that do produce neurologic signs in horses. And, you want to have your vet get on top of that right as soon as possible. So this way, if it is equine herpes virus, they can try to treat it accordingly. Number 4. Remember that this is a reportable disease, folks, which means that if your horse is even suspected of having it or is being tested for it or comes down positive for it, the state vet is going to be notified, and there is going to be certain quarantine procedures that are going to be required for you to have an effect with your barn until that quarantine is lifted by the state vet. Only the state vet can impose the quarantine. Only the state vet can lift the quarantine when all the conditions have been met. And number 5, finally, there is a vaccine out there for equine herpes virus. It does work to an extent. Unfortunately, it does not work that well when we're talking about the neurologic form of the disease, but it does provide protection. It does definitely help most horses, and in a lot of cases now, if your horse is a show horse or travels a lot, it's probably going to be required. So you definitely want to talk to your vet about making sure that your horses are vaccinated for equine herpes virus, and especially if you start reading about outbreaks that may be happening in areas or states near you, since horses do travel quite a bit. So those are Doc's top 5 takeaways when it comes to herpes virus in horses. Again, very broad overview. Hope everybody found this useful. If you do have any other questions, as always, you can email me at drivingwithdoc@gmail.com. Again, that's drivingwithdoc@gmail.com. I will try to answer each and every one of them. And of course, if there are equine vets watching this and cringing at everything that I'm saying because I'm saying something wrong, although I don't think I am, and hopefully I'm not, please feel free to email me and let me know. I will, of course, post updates or corrections. So you can do that, again, via the email or via the comments section on this video. So, hope, again, everybody found that a little bit informative. Hope you know a little bit more about equine herpes virus, especially if you hear about it in the news, in regards, again, to racing or anything else for that matter, and barn quarantines that might be in place. And that's going to about do it for this episode of Driving with Doc. Hope everybody does, get out and enjoy this new spring-like weather that we're having. Things certainly are looking much more up, much more warm, and much more happy for a lot of us that enjoy being outdoors. So, until next time, when we dive into yet another topic that involves your pet's health, hope everybody does well. And, of course, I will be back seeing you next time as we go driving.